you once again for attending our virtual conference this year, Conference 2020, and we welcome you today to the beautiful town of Nassau on the gorgeous hilltop of the Dr. Patrick David Roberts Health and Wellness Center. I'm very pleased today to present on a topic very near and dear to my heart. It's new hope for the diabetic foot, and I'll try and sum up and augment much of what has been said today, but also speak to the importance of feeling. One of the hallmarks of illness is that if you're ill, we've always attached illness with pain. Okay? If you are, if you got a headache, you figure something's going on. You got a sore throat, you could feel it. If you have arthritis of the knee, you could feel it. If you're having a heart attack, you could often feel it. Okay? This idea of sensation to the human body is a marker of wellness. It's a marker of whether you're healthy or not. And the trick of diabetes, one of the great mystifying tricks of diabetes, is that there's a component of it that as you get worse, the longer you've had diabetes, the less and less you can feel. So the sicker you get, the better you feel. That's a strange marker as we relate to illness, right? The sicker you get, you're supposed to have more pain. Not with this thing. With the diabetic neuropathic patient, the sicker you get, the less you feel. So I just saw a lady just now, she has a charcoal foot, and she can walk right through fire, coals, nails, metal, doesn't matter, and keep going. And then she sees his foot swell up, she's like, whoop, what happened? Feels nothing. Nothing. So this is one of the things about our association. We are pushing these three components. Awareness, we want you to know what this disease does to you. Access, if something happens, if you are aware, well, where do you get help? Who do you call? Where do you go? It must be affordable too. And then the last one is action. The diabetic foot is a medical and surgical emergency. Emergency. It is urgent. Something has to be done, and it has to be done very soon. Dr. Clarkson gave a brilliant presentation earlier, Dr. Mitchell earlier, Danae, Dr. Thompson, and you see that what's happening around the world, it's not just in the Bahamas. The entire world, there are 1 million amputations a year. And it's not going anywhere. He said earlier, every 30 seconds, I can hear you all talking in the back there, man. Every 30 seconds, someone loses a limb. There's an amputation every 30 seconds. That's incredible. That is something we should be paying attention to. But the health planners have looked at it, they looked at their budgets, and they saw, in fact, he's dead right. If you went after this and you don't know what you're doing, it'll break you. It'll take your whole budget. And there has been no good news about diabetes since Banting and Best discovered insulin and its uses in 1928. That's almost 100 years ago. And the problem hasn't gotten any better. We're using more insulin. We got one of our famous drug reps here. And it's getting worse. Let's be honest, it's getting worse. People getting bigger, sicker. So what we're doing, and I like this thing, of insanity. So we trying the same thing over and over again, expecting a different result. We've been doing this, being Faki trained years ago now in med school. You come out, I've been doing this for 30-something years. And you try and tell me do the same thing we were doing for 30 years? It's not working. You got to try something different. What do you have to lose? Because what we had been doing is not working. So we're really taking a very new look at this thing globally. Not just us here in the Bahamas, but globally we want to take a new look at this and say, what could we do differently to affect this change? And we could do it. The Bahamas could become the best in the world of limb salvage. You got all the ingredients sitting right there. Many of them sitting in this room. To get it from the basic level to the community level, the cosmetologists, the patients, the Diabetic Association, the outlying clinics, the family island clinics, the specialty clinics in the hospital, the surgeons, everyone understanding the same thing. You treat these people like VIPs. We need to know if they have vascularization. Do they have flow to the toe? It ain't that hard to figure that out. Is there any chance of infection going on in this foot? P, what's the levels of abnormal pressures that are breaking this thing down? Dressing do not heal ulcers. People who have been going to the dressing room for 10 years, we're going to do some of them tomorrow. You will see them on the surgical thing in the morning. They've been going to the dressing room for 10 years. It healed, send them home. 1 month later, poof, voice open. Heal, send them home. 1 month later, voice open. Heal, send them home. 1 month later, voice open. Then people think we're crazy. Why? You're doing the same thing. You get the same results, but you're expecting it can be different. It can be no different. So we have decided at the Podiatric Medical Association to do it differently. We have tackled neuropathy. Neuropathy can be treated now. There's a protocol for it. It works. You can also, certain neuropathies can be decompressed. It works. The wounds that are forefoot lesions because of abnormalities in the forefoot, you fix the forefoot, the wound will heal. It works. Where there is no flow, if there's a chance, and 90% of the time there's a chance with an angioplasty, stem cells, something that the vascular surgeons like Parkinson can do and will do for you, you get blood flow, it works. So why are we losing so much limbs? Because we haven't taken the time to tell you all, the patient, it could be done better. And I don't know, and I put the burden on me, and I put it on my back. As I tell you, put it right on this back of mine. No joke. I know better. My patients do better. Right? And if we can do better for people, you should. That's our new hope. And I really think we're going to go out there with something very new in the new year, starting today, and change the way this is done around the world. 3 things. Treating neuropathy aggressively, okay? Getting infection control under control, because we use Foot Care RX mini clinics and the cosmetology people to do medi-pedis. So you'll have a reduction in infection all around, and educating our patients. And making sure the vascular people understand, look at, we can get these people to you early enough and fast enough to make your job easier. And we'll turn this thing around. So I'm going to go through a very quick presentation for you all. And this is why we do this work. So every time I get up in the morning, I wonder, why am I doing this stuff, man? And could I do it better? Right? And this is kind of my story as to why we do this, and why I really think we could be the best in the world at it. And we can give it a very good try. So this is New Hope for the Diabetic Foot. I'm going to go very fast. We're at the foot and ankle. This is kind of my brainchild. Most of you all know me. And why podiatric medicine and surgery? I was in University of London, had a scholarship to Cambridge University. I had a job at University of Geneva. I was dating the chick on the cover of Vogue Paris. My wife would say I can talk openly. And I was on my way to fame and fortune. And my mother gets ill. They call me and say, look at Danny, your mom, she got sugar. And her toe, she got a hammer toe, big toe. The bottom got a lesion, the top got a lesion. And she got ulcer coming to the bone. She can lose his foot. I said, why? We ain't know, but that's what has happened to people who her age and have this problem. I said, it don't make no sense to me. Why? They couldn't answer it. My mother was my first patient. My mother was my first patient, and she did not lose her leg. Thank God, otherwise I would have stopped. But I kind of promised her I'd do these things. Hi Danielle, that's my daughter in the back there. She's never heard this presentation. And my grandmother, by the way, my mother's mother was diabetic. Her name is Gladys Rain. That's her at E.P. Roberts Primary School. That's his wife. She was diabetic and she died from diabetic foot complications. Okay? So there's a genetic thing to this whole dilemma of chronic disease and diabetes that we could avoid. That's another thing we got to teach people, Faki. This is not, you don't have to go the road of the person before you. You can shift that. We'll see Ms. Poitier tomorrow. Her mother died with no leg. Her Grammy died in the bed with no legs. And her grandfather died in the bed with no legs. So she was like, I give up. She was waiting to die. And I was like, nah. Them little toes, being straighten them, I whip this piece of bone out. You're going to be great. You'll see her walking around tomorrow. It can be done. So it's why we do this. And I got this notion in my head, I have a crazy little head, that every problem has a solution. And you got to decide what you want to be. You want to be in a little place like the Bahamas? We should be able to fix our problems. We ain't that big and we ain't got that much problems actually. It's some nagging little things that are killing us. Right? I got another idea in my head. No ulceration, no amputation. If we could stop the ulcers, okay? Well, it's very hard for you to end up with an amputation. You could end up with a frank vascular incident. You could have emboli shoot off. You could have, really critical limb ischemia. But even still, we could recognize that simple Doppler, simple testing, you go to that. But generally, these people are going to come to us with an ulcer. I'm going to take very careful attention to that slide. This is the dynamic of this Charcot foot, the complete breakdown of the diabetic foot. It is a vascular infection, pressure, disaster. When I say disaster, disaster. This lever here, if you want to point this out, is the strongest lever in the human body. That's the foot, that's the toes, that's the heel. That Achilles gastroc that goes through, gastroc soleus, is the strongest lever in the human body, period. Okay, nothing is stronger than that. If it is functioning properly, it works really well. If it malfunctions, you got a big problem. Even a lot of medics still don't know or realize or look at it closely enough. That Achilles tendon inserts into the base of your femur. That's above the knee, not under the knee. Above the knee is the insertion. So when you walk, when you move, when you press, when you drive, everything you're doing, boy, that's pulling like crazy. Your forefoot is supposed to do a wonderful lever work. It's supposed to rock and slide and glide. When neuropathy occurs, that malfunctions. And then the ultimate thing in the diabetic, the pressure of your body in the vertical plane, all this stands in the vertical plane. Only this little fella here. I'm 200 pounds, I got a size 10 foot, catching hell all the time. You don't even think about your feet. It's like the car tire on a Ferrari. You're looking at the Ferrari. No one pays attention to the tire. You'll ever look at the car tire on a Ferrari? No. You look at the Ferrari, right? No one pays attention to the tire. You let that tire blow, and you're going 150 miles an hour, you're gone. Or you jump in the morning to go to your favorite brunch with your beautiful bride, and the two tire flat. Where you going? Nowhere. That's what this thing represents now. If it's not working, boy, do we have a big problem. So what we're trying to do, we look at diabetes, you all know what this is. It is a chronic disease. That's not going anywhere. You got type 1, type 2. We know the amount of people that have it. You know what's going on. We know the situation in Bahamas. We're pushing to get people to live healthier lifestyles. You gotta decide if you want to live a healthier lifestyle. The Project LEAP is what we talk about. We had a big launch yesterday for us in the Bahamas. This is what the end result looks like if it doesn't work. People that pot red with a massive thing on the bottom of their heel, people at home, keep an eye on this. Project LEAP is lower extremity amputation prevention. So in the medical annals, when you look at your people's file in the hospital, you'll see LEA, the schedule for lower extremity amputation, right? I come home 25 years ago, maybe 30, I forget now, and I put a P on it. I used to put a P on all the file, a big P in red, and I'd write all my stuff in red. P, with a P, with a P, and they're like, boy, where he from? Like, P was for prevention, 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 prevention. Why, once again? You cannot chase these amputations. At some point, we have to be able to prevent these from occurring. Now, people reach a point where you have no choice. I mean, there is no choice. Now, as Waki said earlier, you could end up with a choice between Your life or this leg. Now, you really want to pick your life. So you could lose a leg. But you want to pull people back from that scenario as best we can. That's the stats for the Bahamas. It is terrifying. This is a terrifying problem in the Bahamas that we are still to address. And so our association are making an attempt at pulling it together. And I think we're close. Every time I get back in the game, sometimes they send me an army, and then when I come back in the game, we push these amputations down and say, let me and Clarky run a clinic. You know, they dock us once or twice, but we can get them. Next one. This is a complicated slide, but for those at home who will be able to see it, it tells you all the things that play to get an ulcer and to get an amputation. It tells you have neuropathic changes, trauma, vascular disease. It tells you on one side here, and neuropathy is funny. Eh? You got motor neuropathy, that's how we move. Okay, your brain tells your body what to do in time and space. So I can tell my index finger to touch the bottom of my right earlobe, but I can't see any of them. And I can tell the thumb to touch it too, or touch the top of my earlobe. I can't see them, but I know where I am in space. Okay? This is very important for moving around. So these people, as they begin to lose their control, they lose their confidence too. You gotta be careful with patients now. And they're gonna try to fool you because they're crafty. But you get motor neuropathy, that is gonna give you deformity, a lot of other changes. Sensory neuropathy, okay, that's what I'm talking about, that feeling. They buck their toe, they don't know, nail flies off. I got the lady, she's a runner, she's gonna keep running, and the toenails will fly off in the shoe. Can't feel it, she just keeps going. Yeah, people come in, they still got the nail in their foot, and they're walking around, the blood dripping, and you could hear the nail ding, 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 as the foot hits the tile. Can't feel it. That's a sensation, that's sensory neuropathy, a loss of sensation. And then the tricky one is autonomic. Autonomic, most of the things happening in our body are subconscious. You don't know it's happening. So there are millions of functions happening within your nervous system, okay, at a rate that's incredible that you have no knowledge of that your body is doing. And that's also affected. So diabetes affects people from head to toe. And thinking what's happening is coming out of your brain now. Your brain function is not optimal when your sugar is high or low. And when you get diabetes, it's changing it. People have more strokes who have diabetes. Your eyes, which are connected very closely to your brain, obviously, the leading cause of blindness in the world is from diabetes, retinopathy. Leading cause. And it's preventable. Great tragedy again. Heart disease. These people have greater incidence of heart disease. In fact, we said macrovascular disease. Right? Kidney disease. You know what people we have standing up in front of these dialysis places in the morning? You know the age of these people now? 25, 30, 40 years old, already on dialysis from high blood pressure and sugar. Shame on us. We could do better than this. We could do better than this. The other part, trauma, is obvious, and then vascular disease, macrovascular disease and microvascular disease. They will give you ischemia, slowing of the blood flow to that area, right? You will know the difference when this starts to happen to you. It's a big deal. When that ulcerates and you got vascular disease, you got trauma, and you got neuropathy, boy, we got a lot of work to do. It can be done, but it ain't easy. We're trying to stop you from getting to this point, managing risk again. So Granville Bain used to always say, you know, Danny, you're in the hospital, you sit down right there, if I were to shoot you in your leg, 99.9% of the time we get the surgeons that you will survive. Would you let me shoot you? No. He said, no, boy. No, sir. He said, 99.9% you will be fine. Would you let me? I said, no way. This is what we're talking about. When you get into this scenario of all three of those things coming at you at the same time, you're on the firing range. You're on the firing range. And I think people unconsciously know that. And so chronic disease is also attached with a level of anxiety and depression. because there's no way out. You're not sure if you can make it or not. This is the good news. We're finding some ways out. This is critical limb ischemia. It's a vascular problem. You can't see it great, but on the screen at home, you'll be able to see it. The change in color. So the first thing with black people, and when they sent us in med school, all the people in the book was white. Nothing against white people. But when I come home, all the people in the hospital was black. So the description of the vascular diseases they showed us, we didn't get that, okay? Rubor, pallor, dolor, I didn't even get that. I'm a doctor, so in case you all didn't notice. But you'll see the subtle changes in the color of the skin, from the calf, from the mid-thigh, going down, around the ankle, mid-foot to the toes. And people tell you, man, there's some funny color changes going on here. The change in the skin, the quality of the skin begins to change. The hair, when you had hair on your legs, there's no hair gone. They don't sweat anymore on their legs. The temperature is different, right? They'll tell you, geez, before I have to sleep with 2 socks in the night, right? And they ain't got air conditioning. Their feet are cold. That's a vascular change. These are neuropathic changes. When you see these toes begin to claw. So instead of your toes being like you saw Dr. Mitchell's beautiful toes earlier, they start clawing up like that. And it's a permanent change why the nerves in the foot are decompensating. They're not functioning anymore. And so the toes, people have a stroke, see the hand, the side of the hand thing, and the hand pulls like that. So the flexors in our body are stronger than the extensors. So when your nerves fail, your toes are going to claw. That could be a permanent change unless you do something about it. But when that happens, see the top of his toe there? Man, that ulcerated. It's just a matter of time. And prevention means we can go in there, you see that patient, I don't wait for them to get the ulcer. Or maybe they've had an ulcer before, they've been before, you say, man, Daniel, take a look at this. We can straighten those toes. What happens when we straighten the toes? We won't ulcerate anymore. Ain't that simple? But you gotta get it done. We can go a little faster. So this is what the foot looks like inside. It's a really magnificent piece of work. God had to design it himself. You got 36 bones, 46 joints, 100 ligaments, tendons, nerves, vessels, top and bottom, in each foot. And it takes the pressure of a couple 100 pounds for 70, 80, 90 years, and it never complains. Right? It's a marvel of architecture. This is what happens when the foot goes wrong. Okay, when that lever stops working, when the nerves stop working, when the blood supply changes, the arch, that's on London Bridge is falling down. Yeah, the thing starts falling apart, man. That's all a Charcot foot is. If it starts falling apart. In recent years, we were told you can't operate on a Charcot foot. You can't fix a Charcot foot. No, sir. We're fixing Charcot feet, man. And it's you got to be brave to do it, but they have no other choice. And we have no other choice. And guess what? You get good results. Very good results. It can be fixed. These are the stages people go through. If you don't stop it at some point, it keeps going. Chakra arthropathy is the worst of all of these things. So when you're talking neuropathic changes, the ultimate, almost like a sin, a cardinal sin of diabetes it is put on, plague people with, is a chakra arthropathy. What does it do? It changes the blood supply. It changes the nerve supply. And it completely starts many fractures of the foot. The foot, literally, the bones start to break up and fall apart while your foot is undergoing tremendous change. And in most cases, people can't feel it. If you could feel some of these fractures, you would jump over the moon, but they cannot feel it. So to intervene, we have to always be checking it. And to check it, Faki and I cannot see enough people. We need other people out there who can recognize this and treat it. We need triage and treatment in the same place. We need a national protocol. We need people who are interested and able. I call this thing here black ice. So a lot of people tell us, Done and Co, when I want to teach the cosmetology world this thing. The little person got a callus, and there's chronic callus under this area. Callus is colorless or just has a little white dusky hue. If there is a discoloration to that piece of callus, you know what it is? An ulcer. Underneath that discoloration will be a hole. The callus is so hard, if the king can't drain out, it's going to drain in and up. So these are stage 1 ulcers. So there's one thing we can get in the whole medical community is that people recognize this thing. I branded black ice because it bleeds because they're walking on it, and then the blood breaks down, and this is where the infection can also get in. Our blood internally is not necessarily clean. We got stuff circulating in our blood. If you leave it in this kind of patient that isn't able to mount an immune response, boom, they get a raging infection, and you don't see it, particularly if it's underneath the foot. No one looks underneath their foot. When he or I see it, thing blows up, you go looking for the origin lesion, you put a probe in there, and then woo, straight to bone. Black ice, we got to get that under control quickly. Can be done with offload, you fix it. Tomorrow, we're going to fix 2 people who had this problem for 10 years. 10 years. And they go in a dressing room every 72 hours. They live a dressing room. Part of their life is going to dressing room. This is what the burden of diabetes does. The most common amputation globally is the amputation of the first ray, the big toe. People always say you lose a big toe and they lose their balance. They think they've lost something. And it's a confidence scenario because things do start drifting away from them. And it's a sign of things to come. And oftentimes it happens because of abnormal pressures, a funny issue, an injury, neuropathy, change in vasculature, or some kind of trauma. That's how this begins, but it doesn't end that way. Okay? You must intervene. These are the tendons of the foot. Keep going, bingo. A lot of tendons. If everything is going well, your feet will look like Dr. Mitchell's feet. If things ain't going well, your feet will look like, Jomo Kenyatta's feet. Right? And we know what is normal, and we know what is abnormal. And we're asking people, just if it looks abnormal, it is, and let's check it out. And you fix it. The first range of the first intervention here is to get these tendons aligned. It can be done with expert ease. We're going to show you all again tomorrow, and you'll see pieces of this lecture and maybe a surgery right afterwards to indicate. You can do the flexors, you can do the extensors, you can do them as a set. We do the Achilles, we do the large tendons, we do small tendons, we do the toes, we do the big toe, midfoot, the plantar fascia. All of these tendons can be rebalanced. So neuropathy sets off an imbalance in your tendon structure. And your body is working so hard to keep you balanced normally. Neuropathy sets off an imbalance, and what we seek to do, once we see that, we can rebalance it. Okay? It can be done. And I want to dispel this myth, you cannot operate on a diabetic foot. That's all we do. Every day, all day. This is what goes on inside the toes. A normal toe, which is straight, has balanced tendons. That's all it is. Those toes, if you look at your hand, right? If I look at your hands right now, and in between your thumb and your index finger is a big muscle there. Next time you see a diabetic, you watch them sitting there, you look at that muscle in between their thumb and the index finger, and it's just skin. They have neuropathy. The muscle is gone. There's intrinsic muscles that allow us to do this. Okay, same thing in your feet. In the feet, when the intrinsic muscles go, the toes do this. And you're walking on your nail, and you're hitting this to the top. And they can ulcerate. Most of these things start with a toe. You know what the fix for this is? Yeah, you all know. Tenotomy. Tenotomy, capsulotomy, boop. You straighten them. They're walking normal. No problem. You got to do a Doppler, make sure they got enough blood flow. But straighten them. Even some of them don't have enough blood flow, you better do it anyhow because that toe is critical. And if it is taking abnormal pressure, blood still can't get to the tip of the toe. So we do tendon balancing. These are befores and afters. where people really think you got to go in there and hoist the thing open. These are them big, long incisions halfway down the foot. Go in there with the mallet and chisel. Gang, 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 gang. Blood flying everywhere. You know, well, that's a good surgery. We did a great job, you know, because everything was blood flying everywhere. No, not good. So we've moved to minimally invasive surgery. These feet are done with pinhole incisions, okay, into the joint, shave the bone, release the tendon, one stitch, get out of Dodge. The people can walk on it the next day. You don't have to be in hospital. You don't have to go under general anesthesia, okay? This is where the world is going. We gotta get that to tendon balance. This is what occurs now. So when we do not do tendon balancing, you go fix one spot. In fact, he'll tell you, you see the person, you hate when they come back. We did one toe, I guess when they come back, you had a problem on another toe. You fix one metatarsal, they get on the next one. Let me show you an example. This is my good friend from Andrews, who was actually one of my father's cousins. And so he looked like underneath, keep going. All right. And so we went ahead, and fellas did a decent job. Okay, so we moved the 5th and 4th. Okay, and guess what happened? You think I'm going to 3rd and the 2nd. So you one step forward, 2 steps back. And he's a boat captain. He come back on that boat and say, Johnny, you gone from one problem to the other. You sure you know what you're doing, boy? But this is what's happening. So you want to get ahead of it, do the transfers. These bones, we have to level all the bones got to be hitting at the same time, like playing a piano. That's where they want to be. The transfer lesions too often occurs. This is what the diabetic foot looks like when it comes to us. They call it the 4-foot fiasco. When no one looks at it. That's what me and Fraki get all the time. They wait, then they walk through the door. Say, you can fix this? And that's why you got to be close to God. Because that's the only man you can call on in these occasions. It's infection, it's neuropathic changes, it's vascular changes, and this is how people get amputations. I really think it's waiting too long in the process, and you're dealing with end-stage disease. And what do we want to do? Prevent this whole process from occurring. What you got to do, this high fructose diet that we're having in the Bahamas, this American diet that has swept across the world, McDonald's and Wendy's, all these things they're giving us, this is where we've gotten our metabolism to. You're in danger. Ain't nothing wrong with how our grandparents used to eat. I know we thought we'd look down at them, we thought they're from the island and they weren't educated. They were doing the right thing. We got to reconsider that. I saw all y'all drinking fever grass today. Yay. But it's causing all these chronic diseases on us. I have this notion that you have to prevent in order to help people. In our health care system, if we're not preventing the problems we see coming at us, I don't think we have the resources to treat them. Not that he and I can't treat these people. We don't have enough resources, enough people, enough time. And so the pain and suffering of your population is going to be exponential in the near future. No joke. And if you could just, every person you help a whole family. Prevention is the key. Right? We got a whole crew. I see Doc walk around here. This is me and him. We go to U.S. Army Navy Training Center, LSU, every couple of years. Do some work out there with them. And New Hope is an intervention. It is bringing hope to people's lives. It's comprehensive screening. It's researching what we are doing. It's making sure you get the simplest, safest, innovative procedures to do for our people. Bring the best. This is what we're trying to bring to you all, the best that we possibly can. This is what we used to do. Well, and now, this is what you do now. Okay, so Flaki, tomorrow we can do that 5th on that lady. That's what we do, right through that keyhole, right into the head of the metatarsal, right into the joint, in between the neurovascular bundle. It's an oscillating bone file, straight through bone, cortex to cortex, back out, up and down. Shave that, boom, it slides right over and pops right up. It's still in the joint capsule, it can't go anywhere. One stitch and you're out of it. Okay? Simple, safe, effective, rapid healing. You can do heels, you can do 4-foot, you can do midfoot, plantar fascia, big tendons, small tendons. Okay, this is what these tendons look like in real time, in real space, just in case people are wondering. That's what's inside the foot. We very rarely get to see it. Okay, so they should be relaxed and flat. And in diabetics, they get tight and they pull. And that's where you're going to get the ulcer. Tendon balancing is the way to go, as I mentioned earlier. This is what we're doing. You can get bunions, you can do anything you want to do. This is a patient that we had at South Beach Clinic where they thought it was all gone. And then, in fact, go back one, when they sent this lady to me for they said all her toes were gone. I said, no, I think I see 1 or 2 toes still. So I said, well, anyway, let me clear this stuff off. She hadn't had a debridement in years because everyone got to go to hospital for debridement. I said, no, they ain't got no sensation. They don't need to go to theater. Let's do it here. And I uncovered underneath there 2 nice little toes. Amazing. Okay, these ingrown toenails, all the simple, safe stuff we do. Minimal invasive surgery, once again. Tendon releases for these people. This is Miss Poitier. I mean, her feet, she had such a time with these feet. She's the only person in her family working. Her mom had an amputation, her grandmother had an amputation. She had given up hope. Given up hope. She called her bucket list. So she's going through her bucket list now because there ain't much longer for her. And boom, we went in there and did the osteotomies on these. You can see here, the lesion was chronic lesion under that fourth. And this is 2 weeks later, same foot. Okay, no fancy footwork, simple osteotomy, sliding wedge, boop, pop right up, let her go home, 1 stitch. 2 weeks later. Okay, it can be done. This is what we can do now.
Amen.
All right, this is one of my favorite patients. My wife sent this lady to me. It was one of her friends from the old bank. And she was mad with the world. Why? Because it's been going on for years and years and years. And this is a woman in the bank now. She got like 150 pair of shoes for her. And she got the Gucci bamboo heel and she got the works and can't wear no shoes. And I was like, man, I'm not sure I can do it. But anyway, let's do it. So we went ahead, got her cleaned up, took out the sesamoid bones, did a sliding wedge on the big toe, and go ahead, and she healed beautifully. Okay, simple stuff. Keep going, go a little faster for me. All right, minimally invasive surgery. This is what we're doing now. This is what you'll see tomorrow. And I hope as we edit this film, you'll get to see all the things with the benefits. Smaller incisions, less pain, shorter hospital stay, and now you can't go to hospital. So we've built our own theater, faster recovery, no scarring. You shouldn't have any scarring, increased accuracy, and a very small risk of infection. Every surgery has risks. Don't let people fool you now. There are risks attached to it, and so you have to be careful with who you pick, how it is done, and make sure you check all the boxes, make sure the anesthesia is good, you practice the right aseptic techniques, there's minimal bleeding, and you guard for any chance of infection. I got this thing about the Southern Cross of limb salvage. That's what we're doing now to get this communication between vascular surgery, podiatry, all the people involved in the care of the diabetic foot. We'd like to put this in one place at one time. Before I do die, I can get this done in the Bahamas. Please don't let me have to go to another country and do it. We can try to get this done in the Bahamas. I'm serious. I ain't letting these people no more. We gotta get this done. If you put this in one place at one time, our amputation rate will drop 50% in 1 year. I bet anyone on it. You put me, Faki, and Mission in one place, one time, with some decent equipment, you'll drop your amputation rate just based on that model. The communication, access to care, rapid response. It can be done. That's limb salvage for you. You save limbs, you save lives. This is pre and post-op work, stuff we've done, what people get to. We know how they start, you know how they finish. We did 1,000 cases at South Beach Clinic last year, 1,000 people at South Beach Clinic. And then we had 2 amputations, Mark. There's 2. And they came in from the family island and really were, there's nothing we could do. But the rest of the people, we zooped them up, sent them home, and most of them back to work. Kudos to that group. You know, sometimes, and this is us in the Bahamas, we have to be careful. Although we are a little country, we punch way above our weight. Okay? I've hit the ball with Tiger Woods. I know all of the great fellas all around the world that do this work. One of them sitting right in the back there. We got Stan Burnside, Antonius Roberts, who are revered globally. We got Rhodes Scholars. We have all this thing being done. And sometimes we doubt ourselves because we talk down to our people that we can't do it. And I see people hop on the plane and go to Miami to get something done. And then the people over there say, you know Delton Farquharson? Yeah. Oh. He trained us. And they go, what? They still take you $25,000 to send you home. And I say, good. Then they come home broke and tell me, you got to fix this now. Yeah, no, we don't get nothing for the work we do, unfortunately. And this is a picture, I put this in there. I ain't no fast runner, right? But I played on a team of people who set the world record for the mixed 4x4 relays. We still hold that world record, right? And I went on the track, this is what the teamwork is about. But to tell you one thing, I am the pitcher. And I said to give each other hope. All of us could do something towards this end. It's really about making people feel better, getting more out of life. And I have this thing in my head now. I just turned 55. And I want to get the best out of my life for the rest of my life. I want it to be physical, social, mental, spiritual. And I think the Bahamas is a special place because we get this lifestyle that we have as a little black country out in the middle of the ocean. We enjoy a lifestyle that is the envy of the world. And because if you're healthy in your body, mind, spirit, you're not taking this in. You're not taking it in. And all health and wellness is about is this simple. How do you get the best of life for the rest of your life? Thank you. God bless.